Yep, that was Liberal leader Justin Trudeau, one of the many MPs who rose today in the House of Commons to bring awareness to the stigma of mental health. Perhaps nowhere is hiding mental health concerns more prevalent than in the workplace. So on this Let's Talk Day, sponsored by Bell, let's bring in the Federal Minister of Labour, Kellie Leitch, joins us live. Welcome to the show.
Delighted to be here.
Coming up. Let's talk then. How big is the problem of mental illness in the workplace, and what do you think needs still to be done?
Well, when we look at the statistics, we know that $51 billion is lost to the Canadian economy every year because of mental health issues. We know that one in 5 Canadians is impacted by mental health issues. Obviously, that affects them at work. And so our focus is making sure that we have healthy workplaces, so they're productive workplaces. And I've spent the last 6 weeks, in fact, the last 6 months as the new Minister of Labour, focused on talking to my colleagues who are either from the union movements or, quite frankly, from big business who are in federally regulated spaces and Canadians across the country about what are those issues that impact you the most. One of the things that we're focused on is implementing a national standard. The federal government supported the Mental Health Commission of Canada and a new national standard for psychological workplace safety and health. And this is pivotal. It helps companies develop a plan so they can help their employees identify those concerns that they have in mental health.
Is the problem that people, employees in particular in this environment, are nervous about admitting a mental problem because to admit that could mean they're out of a job?
I think that part of it is that, but a big part of it is identifying those people in the first place. Some people may not be able to even notice in themselves their lack of productivity or that they have a problem. And so one of the things the federal government's been focused on is mental aid, and making sure, and we've trained over 100,000 individuals to identify people in the workplace so that they can get help for their friend. You know, you're right. Part of it is making people feel comfortable to bring forward the issue, and as today is about, let's talk. But part of it is also saying to that person you see has a problem. Maybe they haven't shown up to work. Maybe they've been struggling at work. Maybe you're wondering, you know, why are they just not themselves? Yeah. Saying to them, let's talk, so that they feel comfortable opening up and identifying their own challenge.
How do you drill down to that? How do you drill down to that level? Because, you know, it's all fine to have commissions and strategies, which sounds good, but how do you get down and reach that person who's fighting depression, and the last thing they want to do is talk about it to anybody else?
Well, and that's why Let's Talk Day is so important, because as I say, it's not about them asking to talk to you. It's about being the person that identifies they're having a challenge and saying to them, let's talk about this. Can I help you? What are the things I can do to help you in the workplace or at home or in your community? So, you know, I'm wearing my wristband today. Yeah. Wearing my button. I'll give it to you. You can wear it on the air so that people are aware of it. But it is about making sure that the broader public, all Canadians, are aware of this file so that we can address it head on. Canadians helping Canadians.
Of course, one of the problems that was identified by some of the women in our workplace was they didn't see a lot of action on postpartum depression in the government. That is a major problem. We've seen some horrible consequences of not treating with that. What are you doing specifically to target that particular condition?
Well, as you probably know, my colleague who was in this role prior to myself had talked about having some challenges in the workplace. I think it's important. Yeah, I think it's important that we talk about these things, that we bring them forward so that Canadian women feel comfortable raising this as an issue in the workplace. It's of no value to an employer to have an unproductive employee. And so making sure that mental health issues are identified just like physical health issues are things that we can concentrate on and then start to address them. Have a plan and get someone to a better headspace and a better functioning.
Now, you're in the medical profession dealing more with broken bones than injured minds and that sort of thing. Do you see in the healthcare system a gaping hole where they could catch more of these mental health issues while they're treating people for physical problems?
Well, it's extremely important that healthcare professionals, but even people who deal with children and adults every day, can identify these challenges. You know, in the emergency department, when I see a child come in with a broken arm, you know, mom or dad, even the child themselves may raise an issue that's a mental health issue, and we have the tools to address it immediately. What the national standard is doing with employers is helping develop that plan so that when an employee identifies that they have a challenge, or an employer or their manager says, let's talk, what's going on here, there's a plan for helping deal with that issue in the workplace and getting them the help they need. So I'm delighted we're moving forward with the national standard.
You bet. Thanks for coming and talking.
Thanks for having me. Let's talk, man.
All right.
I'll give you my button right now.
All right. A reminder that for